You are told it is normal to suffer through your period. But what if your pain, your bleeding, your fatigue are your body's cry for help? Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at some of the warning signs that you might be getting from your periods. So let's look at what you expect as normal in your periods. So normal menstrual cycle is a mirror of your health, and here is what is expected. Generally, bleeding lasts between 2 and 7 days. The cycle repeats every 2 to 7 days. A cycle that repeats every 21 to 31 days, every 21 to 35 days. And then the blood loss is between 30 to 80 mils, roughly 4 to 6 pads per day. Then you may expect some mild cramping from the lower part of your abdomen, which should not be severe to disrupt your life. Sometimes some emotional changes, but nothing that hijacks your mind. Your period should not be debilitating. It should not steal you from undertaking your normal activities of life. When does it mean something serious? If your period soaks through a pad every hour, look at it again. Lasts more than 7 days, there could be something wrong. Comes with severe pain, fainting, and even vomiting. This is not normal. You are feeling fatigued, dizzy, or you have breathlessness. Then if your periods disappear for months or happens too frequently, this is not normal. It comes with huge clots or with foul smell. This is not just a period. It could be a sign of something more serious. So, some of the common period problems and what they mean and say. If you're having heavy periods, something we call menorrhagia or heavy periods, this could be due to fibroids, it could be due to polyps, it could be due to a hormone imbalance, or it could be a clotting disorder. You are bleeding from your clotting system not working okay. Painful periods, or what is called dysmenorrhea. This could be due to problems we call endometriosis, abnormal endometrial tissue, which is the lining of the uterus in abnormal places. Then we have condition we call adenomyosis, which is abnormal development of the uterine muscle, and possibly pelvic infections. Then irregular periods or missed periods. This could be linked to polycystic ovarian syndrome, or it could be thyroid problems, or it could be stress. So get checked. Then emotional swings or depression around the periods. This could be premenstrual dysphoric disorder, or it could be hormonal sensitivity. Then sudden changes in your period pattern. It could be a red flag for pregnancy complications or perimenopausal season, or even cervical cancer. So how do you diagnose complications of the periods? So sometimes it would be good to do a pelvic ultrasound. It can help you diagnose fibroids or cysts if you have polycystic ovarian syndrome. A hormone blood test like estrogen, progesterone, and even thyroid test. Then pap smears and the HPV testing if you suspect the possibility of cervical cancer, and even screening for cervical cancer. Then endometrial biopsy might be necessary in some cases if you're suspecting some uterine problem. Then it is important that you track your period with the axe and also journaling. So what are some of the common treatment options available? Depending on the cause, treatment may include iron supplement for anemia, taking adequate iron high dense foods, hormonal therapy for hormonal imbalances, especially in young ladies, pain relief for uncontrollable pain and use of anti-inflammatory drugs, and then surgical removal of fibroids or polyps. Then if you have infection, it would be good to use antibiotics, lifestyle changes for diet, exercise, and even weight management if you cause condition like polycystic ovarian syndrome, and even some hormonal imbalances. And then there is also psychological therapy for premenstrual syndromes. Then how can you prevent some of these problems that are accompanied with the periods? Eat a balanced and iron-rich diet so that you can replace what you are losing during the periods. It is important that you track your cycle throughout the month so that you get to understand it. Don't ignore new or worsening symptoms. Get regular gynecological checkups, especially if you notice things are not okay. Manage stress, and also your hormones might respond to the way your emotions are. And then advocate for yourself. So your pain is real. It is only you who understand it, and if this is a problem, seek help. So listen to your body. Your period is a messenger. When it changes, it is trying to tell you something. Don't just silence it. It could be able to lead to complications. Do not normalize suffering. Period pain, excess bleeding, emotional breakdown, these are not badges of honor. They are warning signs. Take heed. You deserve answers and you deserve healing. Share this video with every woman you know. Comment pain is not normal. If this has touched your story, follow for more truth-telling, life-saving women health tips. Remember to subscribe and follow.